Good morning, Doc. So for this video, I will be demonstrating periapical radiography using the bisecting angle technique. And for this video, I will also be enumerating the various landmarks of the face in dental radiography. So first off, landmarks is defined as areas of the face that provides the dentist with a quick reference in positioning the PID. In the maxillary, we have the following as landmarks. For the incisors, we have the tip of the nose. For the canine, we have the ala of the nose. For the premolars, we have inner canthus of the eye. And for the molars, we have the outer canthus. The same goes for the landmarks in the mandibular except for the incisors, in which the mandibular uses the chin as a landmark in contrast to the tip of the nose as used in the maxillary. So in this clip, I will be demonstrating periapical radiograph using bisecting technique, and here are the materials that we will be needing. So first is the periapical adult film, and then we need the cone, and we'll also be using alcohol for disinfection. First step is to seat the patient upright. And second step is to adjust the patient's head. We have to make sure that the occlusal plane of the patient is parallel to the floor. The next step is to place the film properly. Locate the identification point of the film. Make sure to position the identification point in the incisal part of the tooth. The orientation of the film is vertical since we are using it in the anterior teeth. After positioning the cone, we have to angulate the cone accordingly. For maxillary incisors, we place it in a positive angulation of 60 degrees. This right here is what we call the bisecting technique, in which the angle between the long axis of the tooth and the image receptor is bisected. The X-ray beam is aimed at right angles to this line. X-ray beams should be perpendicular to the film, so that when looking at the image on the film, you can see some radiolucency interproximally. This means that those areas of the X-ray can pass through easily and there's no structure in between. The steps for this demonstration is pretty much the same as the first demonstration, but with a slight difference. First is the orientation of the film. We will be placing the film horizontally for posterior teeth. Second is the cone should be at level half an inch from lower border of mandible instead of placing it at the level of the ala tragus line. Third, we will be using a different landmark. We will utilize the inner canthus for premolars.